malformation is identified as a rare disease, only affecting approximately 200,000 people in the United States. However, Chiari is only one rare disease. There are so many other diseases out there that put a strain on the patient and the people around them. Everybody is probably affected with some kind of sickness, whether it be them or the people that are really close to them. I have experienced everything firsthand from this speech because I have been diagnosed with Chiari malformation. If you've ever had a migraine, dizziness, weakness, tiredness, you can probably make relations to the speech. To explain the effects of Chiari malformation, I will be explaining the types, the symptoms, and the treatments that the patient have to encounter. To understand the basics of Chiari malformation, we need to talk about the types. According to the American Associations of Neurological Surgeons in 1997, Anson and Benzel stated that there are just two main types of Chiari malformation. These are classified as type 1 and type 2. Type 1 is the most common that people hear of when they hear about this disease. Type 2 is referred to as classic Chiari malformation. Type 1 is the most common because there's not very many symptoms at all that the patient has to encounter. They're very minor. Most of the time, type 1 Chiari is found on accident during another procedure or examination. Type 1 is usually detected in later childhood and adulthood, mainly after childbirth because that puts a lot of strain on a person. Type 2 Chiari malformation is a form of spina bifida. Type 2 occurs when the spinal canal and the backbone do not close correctly before birth. This causes the spinal cord to create a sac-like opening for the fluid to flow through. The increased fluid causes the pressure inside the head to increase and the skull bones to expand and appear larger than normal in x-rays and MRIs. Type 2 Chiari looks like the brain is shifted downwards towards the bottom of the skull. If you look at the diagram, this is a normal brain, and this is a brain that's abnormal, and the patient is diagnosed with Chiari malformation. If you'll notice, in the brain cavity, which is right here, this is the cerebellum. The cerebellum is located in the brain cavity, and the black areas around right here, that is openings where the spinal fluid flows. If you notice in the abnormal brain with Chiari malformation, there's an extra part right here. This is the sac-like opening that they're talking about. And if you notice, the black part is not as big. Therefore, the spinal fluid doesn't have a lot of room to grow or to go and to flow throughout the body. Therefore, that is where the pressure comes from and why you have headaches and dizziness and why you have numbness and stuff is because the numbness is caused by that spinal fluid not getting to where it should. In addition to the types of Chiari malformation, we need to learn about the symptoms to better understand this rare disease. Chiari malformation comes with a wide range of symptoms. I'll be using my personal experience to help everyone better understand the symptoms of Chiari malformation. Type 1 Chiari only has a few minor symptoms. Some type 1 patients may not have symptoms at all. However, there are a few symptoms that may occur with the patient that has Chiari malformation. These include headaches, which may turn into migraines, dizziness, tiredness, a little bit of muscle weakness, and tingling in the arms and legs. Type 2 Chiari has a much wide range of symptoms. Type 2 patients can have symptoms that are linked to functions of nerves in the brainstem, which include neck pain, balance problems, muscle weakness, numbness, or any other abnormal feelings in the arms and the legs, dizziness, vision problems, difficulty swallowing, ringing or buzzing in the ears, hearing loss, vomiting, depression, and headaches that may be worse with coughing and straining. Fine motor skills and coordination may also be affected with this. If someone makes a really loud noise, I can strain and get a headache so easy. Or if I barely butt my head or something, it jars, therefore I get a headache. Whenever I'm sleeping, I have to sleep on my side or my stomach because I don't have a gag reflex, therefore it's really hard for me to swallow. But if I get up and I walk around a little bit, I can notice that it's helping with my headaches just for the fact that when you get up and walk, that spinal fluid gets to flowing a little bit better. Okay, now that we know about the types and the symptoms of Chiari malformation, we can talk about the treatments for this disease. There are different types of treatments for each case of Chiari malformation. Every diagnosis is different, therefore doctors cannot take the exact same steps for every single patient that's diagnosed. According to the website columbianeurosurgery.org, conditions are different for every single patient, therefore treatments have to be different for every single patient. On cases that are less serious, Medications are normally the only thing that are given to the patient because there's not a whole lot to do, therefore, the medication's given just to lessen headaches. The doctor may tell the patient to take it easy and not participate in a lot of physical activity, but however, patients with more serious cases have to encounter posterior fossa decompression surgery. This is the only way for the spinal fluid and everything to flow normal. Surgery involves making an incision in the back of the head and removing a small portion of the bottom of the skull and sometimes part of the spinal column to correct the flow of the spinal fluid and release pressure. So that's what we're going to look at in my diagram. The red dotted line is the incision, and the big blue circle is where the cerebral is, and that's where doctors cut the skull right there to give the cerebral more room to grow. They'll take out the C1 vertebrae, which is the top vertebrae, and that relieves pressure and gives more room for the spinal fluid to flow also. Now that we know the types and the symptoms and the treatments of Chiari malformation, and that we know that it's different with every case, I hope that y'all better understand Chiari malformation and what doctors do to help. It's becoming more heard of. Like every time I go to the doctor, I hear of someone else having it, and that's really cool because I just know that there's more people out there that have the exact same disease that I have. Doctors are researching and trying to find better and easier ways to help this and to better the patients. So what would you do if you were told you had an abnormal brain?